Assalamu alaikum. We are here to discuss brain health, a matter of life and a prosperity for a developing nation in the International Brain and Biomedicine Conference organized by Department of Physiology, Government College University, Faisalabad and sponsored by International Brain Research Organization and Dana Foundation. Me, Iqra Chaudhary, here to present strategic role of nanotechnology and microneedles in brain-related diseases. I am a PhD scholar in Pharmaceutics, Department of Pharmacy, Qaid-e-Azam University, Islamabad. Let's start with a brief introduction of major structural parts of the brain, such as parietal lobe, occipital lobe, frontal lobe, and temporal lobe, cerebellum and spinal cord, and brainstem. The CNS diseases and disorders are posing a great challenge for mankind. Today, neurological disorders are among the highest reasons for causing death and disability in the world. Neuropsychiatric disorders and neurodegeneratives are two major divisions brain-related disorders. The neuropsychiatric disorder involves the unusual thoughts, perception, emotions, and disturbance in behavior, and in subset in absence in mental disorders. And the neurodegenerative disorder in which nervous system stops working and or die and usually gets worse over time and have no cure. The neurodegenerative diseases are Parkinson's diseases, Alzheimer, Huntington disease, multiple sclerosis, spinal muscular atrophy, and spinocerebellar ataxia. And the neuropsychiatric diseases are seizures, cognitive deficiency disorders, uncontrolled anger, migraine, epilepsy, addiction, and eating disorders. The wide spectrum of potential drugs are available to treat these neurological disorders, but still there is a gap in the therapeutic success due to the different range of challenges. One of the most common challenges in CNS related disorders are the encountering in the peripheral barriers. Peripheral barriers are the blood-brain barrier in which tight junctions are present across the brain, which unenable the delivery of different type of drugs or entities or substances across the brain, and limited the entry of many drugs via blood-brain barrier due to their insufficient entry in brain as well as a limited access to immune cells. The most of the drugs used to treat these brain-related disorders are lipophilic in nature and having 400 to 500 Dalton molecular weight and are unable to cross blood-brain barrier and in its pharmacologically significant quantity. So that's why there is a need of that technology to deliver these drugs across the blood-brain barrier in pharmacologically significant quantity. We utilize nanocarriers of particle size between 1 and 100 nanometer have been emerged by the development of nanotechnology, among which polymeric nanoparticles, solid-lipid nanoparticles, liposomes, and micelles made their debut as nanocarriers for the treatment of various neurological disorders. But nowadays, newer and more advanced nanosystems such as dendrimers, nanoemulsions, nanogels, nanosuspensions, nanotube, etc., which have shown great potential than the previous drug delivery systems. These nanoparticles have optimum size, surface area, surface charge, and should be biodegradable, non-toxic, biocompatible, cost-effective, and side-effective. These these nanoparticles encounter the blood-brain barrier with different passage of insertion. Means transcellular cytosis is utilized to deliver drug across the different substances across the blood-brain barrier, in which these substances move through the apical or basolateral membrane, and the other mechanism is the paracellular transport, in which epithelial membrane is utilized to deliver substances across the blood-brain barrier. The other is the flux transport, in which different type of P-glycoproteins are utilized to deliver hormones, waste, toxins, and remove or move inside the brain. And the receptor mediated interactions were used by the budding of different hormones, different genetic materials, different drugs inside the brain by a budding mechanism. And the other one is a carrier mediated transport, in which different carriers are present on the cell blood brain barrier cell membrane, such as glucose carriers, which utilized to deliver glucose across the brain. Because glucose is not formulated inside the brain utilized glucose from the outsource. And the other is the absorptive transcytosis, in which different electrostatic interactions was utilized to deliver drugs or any other substances across the blood-brain barrier. And blood-brain barrier is a negatively charged moieties and used to tackle positively charged drugs inside the brain. The nanoparticles deliver drug by using these mechanisms and moved towards the blood-brain barrier and delivered the drug inside the brain. The nanoparticles are basically divided on the basis of materials. Mean different type of materials were utilized to formulate these nanoparticles, such as lipids, polymerics, carbon nanotubes, metal particles, etc. And the size differentiation was reached was 100 nanometer to 1 nanometer, and different surface substances are attached on the nanoparticles, means different type of pegylated or other coatings. Surface functional groups are attached, means thiolation, or different type of carboxyl groups are attached to nanoparticles to tackle the receptor mediated or carrier mediated transport. Different type of surface charges was developed or optimized across the cell, across the nanoparticles, and different targeted ligands was attached with nanoparticles. And on the basis of types, on the basis of shape, different nanoparticles are formulated, which are of spherical, cube, rod, or star, or plate-like structures. And these nanoparticles utilized to deliver the drug across the blood-brain barrier by using the previously explained mechanisms to treat different brain-related disorders. And different nanoparticles and mechanism of to respond neuroinflammation. Once the brain encountered with different neurodegenerative diseases, pro-inflammatory cytokines were released, which in response exaggerate neuroinflammation. And this neuroinflammation was treated by using different type of nanoparticles like liposomes, which are made up of single or multiple phospholipid bilayers and resembles with our cell membrane. And the polymeric nanoparticles are solid colloidal dispersion of biodegradable and biocompatible polymers, such as polycyanoacrylate, polyester such as polylactide, PLA, PLG, and several other natural proteins and polysaccharides are used to formulate polymeric nanoparticles having the size range of 10 to 100 nanometers. Nanoemulsions are oil in water, water in oil. Emulsions are colloidal particulate systems that are composed of edible oil. Surface active agent means surfactants, and these surfactants are used in fluidization of cell membrane and increase the permeability of these nanoemulsions, which permeate across the blood-brain barrier and deliver drug in the brain site. These are having the range of 100 to 500 nanometers. The solid lipid nanoparticles is also an attractive tool to deliver drugs across the cell, across the blood-brain barrier in the brain. These are made up of triglycerides, fatty acids, steroids, cholesterols, and waxes. Dendrimers are also attractive polymeric structures having 3D symmetrical architectures having different projections known as generations, which possesses different functional groups on the terminal surfaces that can be easily functionalized with different ligands. Microneedles and brain-related disorders. Once nanoparticles or to tackle the different drug-related problems was formulated, means to avoid the size issue, to avoid the lipophilic, hydrophilic nature of drugs, we utilize nanotechnology. But once nanoparticles are formulated, we use to deliver these nanoparticles by using a suitable route at the brain site. First, oral route is not a feasible route to deliver drugs inside the brain, because in oral route we encounter first pass effect, large transit time to reach the drugs at brain site. And the other modern technique used to deliver drugs in the brain site is microinjections. But current microinjections method using hypodermic needles, which suffers large damage and irritability to infuse small amount of drugs. The smallest hypodermic needle that is commercially available 34 gauge with OD of 184 micrometer for neuro application, but having an extra cost. Thus, we need a specific route to deliver these nanoparticles across the blood-brain barriers. And we can utilize an emerging microneedle technique to deliver our drugs at a specific site by avoiding a pain and invasive injections, hypodermic needles. These are user friendly, means patient friendly. Patient compliance is the major reason to use these micro needles. They are small enough, a layman can easily be used these micro needles by a single press. The microneedles are far better than these hypodermic needles, which involves long syringes, which is very painful procedure for every patient and needs a practical or experienced person to deliver hypodermic needles. And other local or topical transdermal delivery systems are gels, paste, hydrogels, but these delivery systems are enabled to deliver optimum amount of or all amount of active moieties loaded in these particular systems. These particle system is used permission enhancers to open the pores of skin to deliver the drugs or nanoparticles across the stratum corneum. But these are unable to deliver all drugs because they are vanished by having a large aqueous amount in these gels hydrogels. But microneedles have least aqueous system and is the best delivery method to deliver the drugs across the stratum corneum and penetrate directly in the stratum corneum and deliver drugs. Mainly we utilized 7 different types of microneedles such as solid microneedles, coated microneedles, hollow microneedles, soluble, degradable microneedles, swellable, and porous microneedles. These microneedles utilize the mechanism can be utilized the mechanism of the drug to deliver at brain by using macrophages and monocytes. Once there is inflammation in the body, in brain, macrophages and monocytes activated in the blood circulation and move towards the site of inflammation. Thus, these macrophages and monocytes can be utilized to deliver our nanoparticles exactly at the brain sites of brain inflammation. And these microneedles can be used to deliver our nano drug by the help of macrophages at the brain infected cells. But the challenges faced by the nanoparticles based microneedles to deliver drug effectively and safely brain targeted delivery systems are these nanoparticles should be biodegradable and in nature and provide effective and safe amount. A non-invasive technique was utilized to avoid patient compliance, which is encountered in IV and other invasive routes. A eco-friendly green approach should be developed for the preparation of nanoformulations. The factors like shape, size, charge, and moiety attached to nanoparticles should be well elucidated and evaluated, which is essential for the crossing and developing brain-targeted delivery systems. These are the references which I utilized in my presentation. Thank you.